Hi, my name's Ben Sinclair. I'm a GP and I work home visiting patients in the West Midlands and doing some video consultations as well from my practice, which is called Dr. Finley's Private Practice. So I'm talking today about Prevent. Prevent is my strategy for the here and now in the middle of the dark months of the winter. And there's a few things I think we need to touch on. One is preventing COVID. It's a nasty illness. You don't want to get it. Trust me, I've had it. It's not nice. Secondly is mental health in the middle of these winter months. Thirdly, there's a few other things around that in an integrated way that can really help you with your health that you should be doing right now to prevent other things such as cancer, heart disease, diabetes. So back to COVID. I got COVID in December, early December. It completely wiped me out. I got really exhausted, brain fogged, lots of bad headaches, migraines that I've never had before. I started having horrendous migraines, started having to wear these glasses more, and my hearing was affected. I became a really irritable, grumpy old man, and my wife and children did not like me running up to Christmas, unfortunately. However, I've got better from it now, but it took about 6 to 7 weeks before my brain really came back online, and I'm now able to do more physically because I was so physically exhausted. And I'm normally a fit and healthy chap, go running, 2 or 3 times a week, and would consider myself in reasonably good shape. So I find that COVID is indiscriminate. It's going to attack people. It seems to be particularly getting young men at the moment who are fit and well and really knocking us for six. So here's a few things to think about to avoid getting COVID, or if you do get it, limit the severity. Number one is try and get a vaccine if you can, because it's going to help reduce the spread and reduce the severity in you. Number two is that nutrition is really important. If you are eating a healthy diet containing lots of good fruit and veg, then you're going to get lots of vitamins in. But actually, even with that, you probably need to supplement some vitamins if you're living in England, because we're in a crisis at the moment and you want to boost your immunity. So thinking about adding extra vitamin C, whether that's from oranges or fresh veg or a multivitamin. Vitamin C is an antioxidant, it's really good for preventing infection and boosting your immune system. Secondly, zinc has proven effectiveness against virus transmission. If you take zinc, you're less likely to pass on viruses or catch them. So certainly boost your zinc, and the easiest way to do that is to either eat a ton of apricots a day or to take a multivitamin tablet. Thirdly, thinking about vitamin D. Vitamin D is a really important cofactor in all of your body processes, particularly immunity. In the dark months, we always dip below the normal. We should all be taking vitamin D if we live north of Oxford, and that means supplementing. You could get it in fish, but it's pretty hard to get enough to get a required level for your immunity. Now, those three things are really key, but they're not the only thing. For me, I find that if my immune system is strong, it's because I'm doing regular exercise, but not too much. Also including some meditative exercise alongside high intensity. So I do yoga to try and help balance out the high intensity running that I do, and that really helps calm me down and also reduces stress levels. We all get stressed, and stress is a big factor in immunity. If you're more stressed, you're going to catch more infections because cortisol, that stress hormone, reduces your immunity. So think about reducing stress through exercise and meditative exercise as well. Other things you should think about is social. It's really important to have people you talk to, people who you have fun with, people who you can hang out with, whether that's via Zoom or actually sort of going for a socially distanced walk. But it's really important to have that contact, and that relates to your mental health and well-being. On a mental health front, if you talk to someone trusted, you're far less likely to get depressed, stressed, anxious, or have a psychiatric illness. So it's really important to keep up those contacts, and don't forget people around you who are lonely as well. So I also journal, which I find really good. I write down with a good old pen and a notebook. Try and do that as often as I remember, which helps me to maintain level emotions, process things, and has great evidence for basically for well-being, especially if you include gratitude, which is basically working out something or a couple of things every day you're thankful for. I also am a believer, and I tend to pray and spend time meditating as often as I can, which again boosts my spiritual well-being, and I believe helps all the other areas of health as well. So those kind of things are really important right now, not just for COVID, but also for your mental health, for your social health, for your productivity at work. And if you can do those kind of things, you're far less likely to get overweight. Those nutritional tips are going to reduce your risk of cancer, heart disease, and if you'd like to know more, please do get in touch for a lifestyle consultation, which can be video, or if you're COVID-free, in Birmingham, face-to-face in our clinic. So thanks for watching. The next in this series is going to follow shortly, so watch this space.